everyone, and welcome to Verlita's Everything in Between podcast. I am the podcast creator and your host, Verlita Odom, and I'm so happy you guys have joined me today. But before we get into things, I want to say welcome to my new listeners in Barbados and the United Kingdom. I'm so happy that my audience is growing, and I hope that you guys are able to find something in my episode catalog that will help you, enlighten you, encourage you. And so welcome aboard. That means that my podcast officially has listeners in the United States, Germany, New Zealand, Canada, Barbados, Australia, India, Norway, and the United Kingdom. And I'm so looking forward to growing my audience even more. Thank you guys for your support. Today's episode, I'm going to be discussing women in depression. It is actually a continuation or a part 2 to a discussion that I started in May, which was Mental Health Awareness Month. I definitely wanted to bring you guys this episode before weeks ago. Actually, I wanted to bring the episode to you in the month of May, but unfortunately, life gets really busy and sometimes I'm not able to record as often as I would like. I'm definitely going to try to work on that in the future, you guys. But again, I am building my episode catalog, so there's information there that you guys can go and review and listen to things and submit questions. I do want to encourage my new listeners in Barbados and the United Kingdom and all of my established listeners to remember that you can always send me an email at only1vlo2@gmail.com. You can always leave voicemail messages. Again, email, voicemail messages, and of course, sometimes with some of the episodes, I do attach survey questions. I really want you guys to be interactive with me. Tell me what you're learning. Tell me what you've experienced, and submit episode topics, things you want to hear in the future. So again, today's episode is about women in depression, and I hope that what you hear today definitely enlightens you and encourages you as well. So we will get into it. I'll see you in a brief second. But today's episode, we're going to be talking about depression in women. And just a reminder, the information that I'm going to be citing and speaking on, I did pull this information from the National Institute of Mental Health, and I always like to share that with you guys. So you can actually go and get the information for yourself firsthand, or if there's something that I briefly touch on, I just want to encourage you all to go and follow up and get additional information if that's what you feel is necessary. So there's going to be 5 things that the National Institute of Mental Health really wants you guys to be aware of when it comes to depression in women. And there's a lot of similarities between depression in men and depression in women, but there are also some very interesting differences as well. So I just want, bear with me if some of the information is a repeat, but I don't really think that we can get this information, too many times. It just helps you commit it to memory. It helps you get a deeper understanding, maybe even reflect on it a little bit more. So let's talk about depression in women. Depression is, a real medical condition. It is not something that a person is just able to snap out of, right? Or even though, a lot of people feel that way. They feel like if someone's depressed, they just need to, snap out of it, do something different, change your hair, move somewhere. And hey, all those things can be good pick-me-ups. But at the end of the day, if you truly have the medical condition of depression, it is going to return unless you seek treatment. And most people who have depression need treatment in order to see improvement, in order to feel better. Feeling bad is something that, we all go through, right? We all go through sadness. We all go through difficult times. And the sadness will usually go away after, a little time. But with depression, it's an actual mood disorder. It can impact your life, the way you function from day to day. Most people with depression need treatment to feel better. Even if depression is something they battle throughout their life, they can feel better in time with treatment. And just as I mentioned before, on the previous episode, treatment can be psychotherapy. I just think that psychotherapy definitely is something that benefits. If you're going to take medications, I just feel that, therapy is something that should go along with it. But again, as I said, most people with depression will need treatment in order to feel better. And what should you do for that? You should go talk to your PCP, your primary care provider, and let them know how you're feeling. If you don't even go to your PCP, you can actually seek out someone, a professional like a psychiatrist, a psychologist, a licensed clinical social worker, a licensed professional counselor, and just let them know, if it's your PCP or actual medical doctor, they can do physical examinations, they can run lab tests, especially with it being possibility of it being hormonal in a female. You want that medical the medical work, you want the lab results, you want the physical examination, because it may not be I'm just sad and I can't figure it out. There could be actually something going on in your body that is causing your depression. And so you need to be checked out by a medical professional, just to rule that out. You want to communicate with them, and let them know, what's going on with you. When did you start feeling depressed? Do you start feeling that way maybe at certain times of the day? Is it attributed to certain things that go on throughout your day? How often do you feel this way? Is it for a brief periods of time during the day, or stretches of days or weeks? And do you find that there's anything that you do that actually helps improve your mood, or helps alleviate the depression that you're feeling? They'll need to know all of those things when you talk with them. So it's definitely important that you be very honest with them about those things. The more transparent you are, the more likely they are to make a more accurate assessment and diagnosis, and then formulate the appropriate treatment plan. Again, the first thing that the National Institute of Mental Health says for depression in women that we need to know is that depression is a real medical condition. And again, that's something that was even stated for me, and we just all need to know that it's not made up. Right. It's not all in a person's head. The second thing is that depression can hurt, literally. Sadness is only a small part of depression. Some people with depression don't even feel sadness at all. Right. I know that's kind of hard to believe, and that might be the first time any of you guys have ever heard that. But I'll say it again. Some people with depression do not feel sadness at all. A person with depression may experience many physical symptoms. They may have trouble sleeping, trouble waking up in the morning, or feeling extremely tired, just really fatigued, right? So if you have been experiencing any of these additional signs and symptoms for longer than 2 weeks, you may be suffering from depression, ladies. So persistent sadness, anxious or empty mood, feeling of hopelessness or pessimism, irritability, feeling of guilt, worthlessness, or hopelessness, decreased energy or fatigue, difficulty sleeping, early morning awakening or oversleeping, loss of interest or pleasure in hobbies or activities, moving or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering, or making decisions, changes in appetite or weight. It may be an increase in appetite, increase in weight. It could be a decrease in appetite and a decrease in weight. Thoughts of death or suicide attempts, aches or pains, headaches, cramps, or digestive problems without a clear physical cause that do not ease even with treatment. So this is really exactly how it could manifest into physical signs and symptoms that you really need to, speak to someone about, right? So again, you're going to want your healthcare provider to know when your symptoms started. You're going to want them to know, what time of day they happen. You want them to know how long they last, how often they occur, and if they seem to be getting worse or better in time. These are things you want to be open and honest and transparent with your providers about, whether it's your PCP or your licensed mental health professional. When a woman is pregnant, because being pregnant is hard on a woman and on her body, to see the aches and pains that come with that, the stress and anxiety, sometimes of the anticipation of childbirth, feeling maybe that you're not prepared for it. So, it is common for women who are pregnant to experience some depression. Again, morning sickness, weight gain, mood swings, because your hormones kind of out of whack at times, are all over the place. So it definitely can happen. And perinatal depression is also a mood disorder that can affect women during pregnancy and after childbirth. A lot of times you'll hear people say, oh, well, you have the baby blues. Mothers with perinatal depression experience feelings of extreme sadness, anxiety, and fatigue that may make it difficult for them to carry out daily tasks. Perimenopausal depression. That is something that happens when a woman is transitioning into menopause, which is a normal life phase for women. But of course, it can definitely be challenging. And if any of you follow Oprah Winfrey right now, she has been putting out a series of conversations with well-known celebrities who have experienced menopause, including herself, and to hear them describe the things that they have gone through and how their bodies changed and what they experienced is quite interesting. And it's definitely worth a listen for those who are experiencing menopause or those who are maybe in perimenopausal phase in life. Even if you're not, it's definitely interesting to and educational, informative, as a woman, to hear the things that I will be experiencing one day. So it's good to have that information already out there. Of course, it's not just her friends. There are also, MDs, medical professionals that are taking part in the conversation as well. So for those of you who are interested, I definitely would recommend you guys go check out that conversation. So just understanding that, as women, we obviously are very unique. And with that, means that even things like depression may present completely different in us. And we just need to be aware of that. Also knowing that as we go through life phases, giving birth, going into menopause, your mood can change based on various factors. Hello, all of my VEIB podcast listeners. If you've been educated, enlightened, informed, or encouraged by what you've heard on today's episode or by things that you've heard in past episodes, I think you should consider becoming a podcast supporter. You can do that by donating to my Cash App, which is Elevated Faith, or my PayPal at Elevated Faith VO. Your donations simply ensure the publishing of future episodes. Thanks in advance. Be well. Depression can be treated. That's the good news. And that's the fourth thing. I've said that numerous times during the previous episode and now, of course, during today's episode. But that is to give you hope so that you understand that you're not alone. There are professionals there who are trained and understand depression, and there's help for those of you who have been diagnosed or will be diagnosed or believe you are experiencing depression. There are antidepressants. Of course, those medications are used to treat depression. People respond differently to antidepressants. You may feel like you need them. You may try them and not like them, not like the way you feel on them. Or you may try them and feel like you actually are benefiting from using the antidepressants, right? So there are many different types of psychotherapy. People with certain conditions benefit more from a particular therapy. And so, there may be a certain therapy that's recommended for whatever it is that you're facing. I know we're talking about depression now. But for people who have mental illness and they're depressed and diagnosed with bipolar disorder or schizophrenia, then there are other types of therapies that are shown obviously to be beneficial to them, such as CBT, which is cognitive behavioral therapy, or interpersonal therapy. But the approach that your therapist decides to use with you depends on the condition being treated. Also, of course, the training and experience of the therapist. They need to be trained and experienced in the therapy that they're administering with you and that you're taking part in. We all know, again, depression affects everyone differently. So there's no one size fits all. So even though a certain approach may be recommended when treating depression, it doesn't mean that approach or that particular psychotherapy is beneficial to you or for you. But you and your therapist can work together to make that determination on what best treatment is needed for you in your situation. And so that is pretty much it. Let's talk about what you need to consider when you're looking for a therapist, ladies. Obviously, this is someone who you're going to need to be working very closely with, right? So you want to know about what their professional background is, and guys, the same thing for you. You want to know what their professional background is, what their specialty is, or their specialties are. You want to find a therapist who has experience working with your specific condition. You want to find out what kinds of treatments they use. Ask if those treatments are effective in dealing with your particular mental health problem or issue. Find out how they'll evaluate your progress. So determine how long treatment is expected to last and when you should expect to gain relief from your symptoms or improve your quality of life. Don't be afraid to keep looking. Rapport and trust are essential. And again, this is information I'm taking from the National Institute of Mental Health. And I just think these pointers here for finding a therapist are absolutely excellent as far as I'm concerned. These are all things you really do need to do that I'm stating here. Asking about their area of expertise. Find out what kinds of treatments they use. Find out how they'll evaluate progress. Don't be afraid to keep looking. Even if you start off with someone, if it's just not working for you, you deserve to have a therapist who is invested in your well-being and is committed to the best options for you. And obviously you need to make that self-commitment as well. So even if you start off with a therapist and it doesn't work out, it's okay to keep looking. It's perfectly fine. And your therapist shouldn't have a problem with that either. So that is basically it, you guys. Again, the things that you want to know. 1, depression, ladies, is a real medical condition. It's a mood disorder. 2, depression can hurt literally. We went through the signs and symptoms that can manifest as a result of depression. 3, certain types of depression are unique to women, obviously, because we as women are unique. We carry a life. And so you can have depression associated with that due to all the physical, emotional, hormonal, biological changes going on in your body. And that could be during the pregnancy and even afterwards, right? And it's not just the baby blues. If it's actually depression, it's something that you're going to need to talk to someone about and seek treatment for, ladies. 4, remembering depression can be treated. So you don't have to suffer. You don't have to feel alone. You just need to acknowledge what you're feeling. You need to be willing to seek help. And when you do, be open and transparent about your symptoms. Again, I went over, what you need to, talk to your doctor about as far as what you're experiencing, when it started, how long, how frequent. Is it getting better? Is it getting worse in time? And then again, number 5, researchers at the National Institute of Mental Health and across the country are dedicated to women's mental health research. And there's a lot of research out there. Again, I just happen to use the National Institute of Mental Health as a resource for this episode and for the previous episode. But there's so many. All you have to do is just Google depression, mental health, women's health, depression in women, depression in men. There's so many resources out there you guys. So you really need to, you are worth the effort, the energy into being better and feeling better. And again, even if depression is something you battled throughout your life, it very well may be, it doesn't mean you're always going to have the severity or the frequency of it. You can get better and feel better in time if you're willing to put in the work for yourself and find the right professional. And then again, went over the information and some of the things that you need to consider when you're looking for a therapist. And I think that those points were very, very important as well. So I hope this episode was informative to you guys. I always want you to, know the source of information so that you can go and find that information for yourself. I just want to also just reiterate this. If I did not mention in the last episode, I definitely want to say it now. If you are in immediate distress or if you're thinking about hurting yourself, you can call the National Suicide Prevention Hotline. It's toll free at 1-800-273-TALK. That's 1-800-273-8255. You can also text crisis text line hello to 741-741. And there's also, the 988 number now, the National Suicide Crisis Hotline as well. Again, it's 988. You can use the National Suicide Prevention Hotline website as well. So again, there's just really a lot of resources out there. And again, I'm thankful that there's been so much attention drawn to mental health in the last few years, especially since COVID, which was, has been a terrible time for many people. And so many people are, still recover from that time period. And that starts with acknowledging that we all went through some things. We lost family members and friends, loved ones. We experienced a time that many of us have never seen in our lifetime, and hopefully we never will again, although science is saying we probably will. It's okay to acknowledge that you need help, and that's what we need to do. Never lose hope. Never lose hope, because as long as you have life in your body, there is hope and there is help out there for you. Thank you guys for joining me again. Just a reminder, if you want to follow me on Instagram, it is Verlita's Everything in Between, and there's underscores between each of those words. Also, you can listen to me on different platforms, but I prefer you guys listen to me on Spotify. That's the preferred listening platform for me, is Spotify. They keep the most accurate information. If you guys want to send me an email, you can do so at only1vlo2@gmail.com. Again, that's only1vlo and the number 2 at gmail.com. And if you would like to contribute financially, there should be a link on the site that you are listening on where you can actually contribute financially. It just helps to ensure the publishing of future episodes. I would love to continue to bring you guys more information in different areas. You can make suggestions if you email me or send a message here on this platform. If you have suggestions about things you want to hear discussed, please do so. Okay, I hope, again, all is well. You guys continue to be blessed.